So yes, I think we're going to get started. I'm sure there is going to be people who will be joining us as we go. I'm just going to start off with the introduction of actually our big inaugural lecture tonight with Dr. Ben Gaunt, who I'll introduce in a minute. My name is Dr. Madeleine Muller. I'm a family physician. I'm working at Nkobela TB Hospital. It's a large TB hospital in Mtansane in East London, right next to Cecilia Makiwani Hospital, and we do all the TB. So we see very complicated drug-sensitive TB patients, but we also look after MDR TB patients and pretty much all the XDR TB from the eastern side of the Eastern Cape usually starts off with us. So if you need anything to do with TB, then I'm the person to talk to. But my other hat is with the Rural Doctors Association of South Africa, which is a voluntary organization for doctors passionate about rural health care. I've been supporting doctors in rural health for many years. And I particularly have the mentoring portfolio. And myself, and some of you will already know Dr. Jenny Nash, who's our family physician, DCST, specifically for the our local, for our local area in our Matola district. She's also been part of RuDASA, and we have talked for a long time now about creating some sort of orientation program for our new doctors joining rural healthcare. It's always a bit overwhelming. You come from a different province, or you're coming from a large teaching hospital, even Frere or CMH, and it's very different when you first arrive in a little rural facility out in the sticks. It's all very pretty, but it's also pretty scary. And I think what one doesn't always realize, especially if you're at a very small facility, is that there's lots of doctors going through similar things, only 2 or 3 hours drive away sometimes. And the idea is to help orientate you a little bit to rural healthcare and to give you key skills, ideas, resources, and particularly that you meet some of the local mentors and experts in the Eastern Cape that can give you a hand when you get stuck. So just a little bit of housekeeping. Sorry, I'm just making sure we admit people. There we go. So obviously I've muted everybody, and we will make place for time for questions at the end. But I'm also going to ask, please put your questions on the chat if you can, because then we can see if there are questions that are all very similar, then we can answer them together. If you would like to ask a question in person, please see if you can find your hand button. If you're struggling to find your hand button, then just send me a message on the chat. While Ben is speaking, I'll be keeping an eye out on those. And then you'll have an opportunity. While you're listening, you're welcome to just use your audio. You don't need to use to have your audio on mute, as well as stop your video sharing. But when we get to the point when you're chatting, if you have enough Wi-Fi and you want to video share, you're very welcome to. It's always nice to see a face when we're talking to somebody. Just in terms of knowing who's here today, we'd love it if you'd introduce yourself. So with that, I mean, please, on the chat, just tell us who you are, where you're working, what kind of job you're doing. So are you a ComServe, are you a rehab, are you a doctor? My screen is not participating. There we go. And if you can, an email address if you'd like to be part of the program in the future, and I'll make sure to get hold of you to be able to sign you up if you want to join for the whole thing. So Jenny and I, as I've mentioned a few years ago now, started talking about how can we help rural doctors. We were thinking of community service officers, doctors, but actually all doctors arriving at a new rural health facility. And the challenge has always been, how on earth do you do that? So we were looking at, trying out a weekend program, trying to get them to maybe, go get the DOH to get them all a day off to come out to some central facility, and you have to organize accommodation. And the one thing that COVID has done, which has been absolutely extraordinary in the last year, has created a whole new way of being able to really network, even if you're out in a rural district, and being able to create an online orientation training that doctors can do at their own pace. They can either do it in small groups in their own facilities, they can do it after hours, and they can also be selective. So you can decide, gosh, while I was at Frere, I did 6 months of obstetrics. I feel very confident on obstetrics, so I don't need to spend hours going through the ESMO-E slides, for example, but you might feel not so confident on the new HIV guidelines. So you can actually tailor make your training as we're going to go through the 6 weeks. So we've just structured it as 6 weeks just to give it some sort of body. And you'll see every week we have a bit of a theme, and we'll send recommended online webinars, training videos, training presentations, online courses. So we'll give you a whole lot of resources that you can look at. And then every Monday evening, there'll be an interactive Zoom session. And quite often we'll have a little bit of a FAQ on whatever you've covered in the previous week. What's also great is we're teaming up with WUSU, Walter Sisulu University, our local medical school, where a great family physician, Dr. Dylan Gibson, he's actually on the Nelson Mandela Metro side. He has been organizing weekly tutorials. And initially it started for family medicine registrars, but we actually find all of the rural doctors find it very useful. So we'll send you the links for those as well. And again, they'll all be recorded. So if you can't get to all the Zoom sessions, you can watch them at another time. So for example, this Wednesday evening at 5 o'clock, Dr. Nori Gibson is going to be covering colifractures and reductions of fractures and how to do hematoma block and some useful orthopedic skills that will be in that Zoom session. We'll also send you all the necessary guidelines that you need on a specific topic and also protocols. So HR protocols, for example, this week on how do you apply for leave, etc. And very importantly, through the Zoom sessions, you're going to meet people. You're going to meet Ben tonight, you're going to meet Jenny, you're going to meet Dr. Mondondo, our obstetrician, and you'll meet a variety of amazing people, very passionate about rural health, that is there to give some support when you are struggling. So who is it for? Well, initially, we, of course, started thinking of the community service officers, doctors, and then we sort of realized, hold on, any new doctor, any new clinician, whether it's a nurse or a clinical associate or one of the rehab people, have a little bit of questions of finding their feet within the department. So you'll notice the clinical things are still very doctor orientated, but we're hoping to add a lot more information also for the different cadres. But there's also a lot of information that is open for everybody, like tonight's session where Ben's going to talk a bit about the ins and outs of the ECDOH, but also in terms of how you apply for leave, that's valid for everybody, how you prevent burnout, patient-centered care, a lot of the soft skills stuff, that's very much valid no matter what healthcare professional you are. And so we're really making this as inclusive as possible and as big as possible. So just to give you an example of what it looks like, I'm going to show you, this is the example of the week 1 program. So when you sign up, which you'll be doing by sending me an email or a WhatsApp, sending me your details, I'll sign you up to the program. And then every week on the Monday, you're going to get a program like that. So I'm going to send this out this evening. I was just getting the final links for Wednesday's Zoom lecture. You'll see in the blue there is our Zoom sessions for this week. There's 2 this week, the one tonight, and then one Wednesday, which is the WUSU program. And then there is a range of little different online tutorials. And this week is going to be on TB and HIV. So there's a whole little webinar series, for example, specifically on drug-resistant TB. There's a whole little recorded webinar on drug-induced liver injury, quite a key topic if you're in a district hospital setting. And then I'm also going to be posting some online TB videos specifically, and I'm looking for some nice HIV materials, which we'll also send. And then you'll see in the green here is the actual guidelines. So the latest HIV guideline, the latest TB guidelines, the latest drug-resistant TB guidelines, and we've got a nice link there with Zitulele, who's got a great sort of a gathering of useful policies and protocols for staff in the ECDOH. So for example, all your things you need to know about leave or disciplinary matters, injury on duty, RWAPs, etc. So every week we'll do this. And what will happen is I have lots of rural doctors contacting me and saying, oh, you must include this and you must include that. And we needed this. And we'll slowly be adding it all in. And what RuDASA is doing at the moment is we want to create a great big central portal where we can then start being able to put all of these materials. So as we get them, we're going to be adding them to one big 6 weeks program. And then as we get that program together, we will then be able to create access to like a complete program. To give a little bit of protection on the information, we'll do it through the RuDASA portal. And so therefore, we'll ask people to just join up with one of the Rural Health Network organizations, and you'll get a free login to the membership section. RuDASA, for example, is free membership, and you'll join the Rural Health Network, and you'll be able to access that materials anytime during the year as we go on. While we're developing that portal, we'll be sending out all of this information through the website. I think that's enough talking for now. I'm going to take more questions about how the course works at the end when everybody has joined.